Hello again, everyone, and welcome to day 6 of the live updates from Vine Health. This update is geared towards the general public. It's meant to keep you informed about the latest developments in the coronavirus pandemic. It's also meant to help you with keeping healthy, staying safe, also to present facts and not fiction, because there is so much fiction out there. I'm coming earlier today because I have a few other things to do right after this, and I thought I'll come early and then we can always save the video and you can watch it later and share it with your friends and family. So as you know, Vine Health is just focused towards wellness and helping you stay well. That's the whole point of Vine Health. Hence, we do all the supplements, we do all the talks. We've not been in circulation for a while, but desperate times call for desperate measures, and hence we're here. So I'm going to pick up from where we left off yesterday and just answer some questions and then talk about what's happened since yesterday. I got a couple of questions. The first question was an interesting one, which said, can it fly through the air? Well, the coronavirus cannot by itself fly through the air. So if somebody sneezes and there's nobody there, it will settle on the surface and that will be it. However, it's spread, like most of the viruses, what we suspect is spread by droplets infection, and then you carrying it into your sort of the mucosa, so eyes, nose, and all of that. So hence we say don't rub your face. So it doesn't in itself fly through the air looking for who to infect. Not like that. It's basically somebody has to be there to receive it. So it's passed from person to person to person. So hence we say social distance. If you maintain a good distance, somebody sneezes, then it wouldn't get you wouldn't get it. And that's why some people wear masks, I suppose. They don't want to get the sort of droplets into their noses. So that first question, it doesn't necessarily fly through the air. It has to have a waiting receptor. It has to have a host that is waiting to get it in itself. Sneezing, if somebody sneezes, it travels a very long way. You'll be surprised at how far sneezing travels. So it's quite important that you maintain social distance and that you stay at home. Stay home. You can't go out. You can't be going up and down. It's not business as usual. You get your essentials and come back home. One of the things that has raised concern from me since the last few days is that many places of worship are still planning to gather tomorrow, and that is concerning. I strongly believe that no place of worship, no parties, none of that should happen tomorrow. Whether you're 10 or 50 or 40 or 1,000, don't gather tomorrow. My church personally has an online link for service tomorrow, and if you want that link, send me a message after and I'll paste it. And I'm sure there are many Muslim mosques and Hindu places of worship, many other places that will gather online tomorrow. It is a smart thing to do. Do not go to church. If you're a pastor or an imam, do not call people to come to church tomorrow. You will spread the disease and you will have people's lives in your hands. Okay, I think that's enough, and I think I've made that pretty clear. Second question I have is, how long will this go on for? I've had a few people ask me that either in the office or on the phone, to say how long will this whole thing go on for. The truth is, nobody knows exactly how long it will go on for. We believe that if everybody obeys the regulation to stay in the house and only travel if essential, and travel very, very safely, then we will break the cycle of transmission. And then, in the next sort of 12, 14 weeks, we'll see the new cases start to drop exponentially. So we don't know how long it will go on for. It depends on all of us working together. Now, I titled this Chloroquinegate because we've been having this chloroquine debate for a while, and people and I think it started from the US, and with the president saying that chloroquine is very, very, very promising, and it's been proven to work, and all sorts of things. And I actually watched it yesterday. I actually spent an hour in the evening watching the news for you guys. So it was painful to watch yesterday, to watch President Trump talking about chloroquine and getting very upset when anybody asked him a question, trying to sort of really push him on that. And Dr. Fauci, was very uncomfortable, clearly. Chloroquine has not been trialed. A trial means that you compare the drug with the standard that is used for it. We have no standard for COVID-19, so hence you cannot have a trial of chloroquine. It's been said to have been used in some cases, and it's been said to shorten the pneumonia, but as I said, it is not proven. And then on the back of that, people are taking chloroquine and buying it over the counter. You are going to hurt yourself really badly. Please stay away from chloroquine. It's a toxic drug. It cannot be used over the counter. You cannot just take it. It would not prevent coronavirus. So that was very interesting yesterday. So it's Chloroquinegate now, but I also heard that in Lagos that a trial has been commissioned to try to see if chloroquine would work. I sent a message yesterday to NAFDAC and to say, look, do you know anything about this? Can you tell us where this trial is taking place so that we can actually prove it? We need evidence. Evidence is so important right now. Right, so that's that part done. So the next part of this morning is just to give you the updates of what's happened in different places since yesterday. Starting with the United Kingdom, it's a total shutdown. So from this morning, everything is closed. I mean, I love going to the gym, but there's no more gym for me. No more gym. Everything now has to be done at home or around your house. Go for a walk, go for a run. Make sure you maintain your spaces. Make sure that you're not coughing in anybody's face or you're not touching people or close to them. So all cafes, all leisure places, all gyms, all pubs, everything is now closed. It means you need to stay at home. That's what happened since yesterday here. The number of deaths in the UK, unfortunately, has also gone up to 177 as of yesterday. Again, but you have to put that in context. Over 66,000 people were tested. Most of them were negative. About 3,000 or so were positive. And out of those positives, we have this number of deaths. So we have to put it in context that most people will express it very mildly or moderately, and is the most vulnerable, usually, that would really, really suffer. But you cannot determine how you will express this illness. So don't get it, try your best, and don't spread it. And as doctors and clinicians, we are trying our best to stay safe as well. We're trying really, really hard to stay safe by minimizing any face-to-face consultations and making everything remote and virtual. Health is going virtual. I've been saying it for years. Healthcare has to go virtual. Also in the UK, businesses are really being supported. I mean, wellness and wealth go very well together, and I'm all about wellness and wealth. And the government is really supporting businesses, is cutting business rates, is putting in a retention scheme for people who are, have the risk of losing their jobs, so that their employers can pay them throughout this time, is sort of stemming VAT payments. Just so much has been put in the United Kingdom, and I think it's the right response. Now, to go to Nigeria, what's happened since yesterday? As I mentioned, the chloroquine trial it's been commissioned according to for Lagos. It's what I've heard. Again, I've tried to confirm that by sending a message, and I'm waiting to hear back about this trial. Also, Lagos is making the right response. Closing the borders to foreigners, I think that's the right thing. And if you are a local coming back home, please self-isolate for at least 7 days. I know they've said 14 days, but if you've been isolating here, then just isolate. Just keep yourself away from other people. I know that you might know you don't have it, but it's best to keep safe. Right, so I think that's basically it. I won't go into all the negativity and all the things that are going on around the world. I think everybody knows that the news is full of all the news, and it's 24/7. It's hard, even for me as a doctor. Listening to that news affects my mental health. So please do not put it on 24/7. We know that there's a global pandemic. We know that it started in China. We know that China is improving massively. It only recorded one new case yesterday, from what I heard, so it can be done. But turn off the news. I will bring you the news in the morning around this time, and you can always keep yourself apprised of what's going on. I know we've gone on longer than I think we should, but I'll finish off with general health, keeping your general health and your general health and your mental health strong over this next couple of months. This couple of months is going to test all of us, but we can do it. We can do it. We can do it. Trust me, we can do it. So what I'll say is your exercise regime, put that in, make that routine, make it super strong, which is the only thing you can do is to work out at home. Almost every website I go to now has home workouts on their website. Even regular shops are so innovative and are putting regular workouts on their page to help people know how to exercise at home. Put in an exercise regime of at least 30 minutes a day at home. Mix it with cardio exercise where your heart rate really goes up, and also resistance exercises where you're using your muscles so that you don't have muscle wasting. You need to sort of do that, things like push-ups, sit-ups, press-ups, pull-ups, anything you can do, go into your garden, but make sure that that's a routine that you're doing every day for at least 30 minutes. What I'm going to be doing myself is continuing to do my walks around the green spaces, staying away from people as much as possible, and running as well. Not usually Saturdays is 10K, 10,000 steps Saturday. I've done a lot more than 10. I've done probably 100,000 steps this week, if not more. And I will still be doing my 10,000 steps. If not today, I will do that tomorrow. So exercises, walking, running, resistance exercises. The exercises will keep you slim so that you don't put on weight, but will also help your mental health. And honestly, if you're not well in your mind, you can't really be well in your body. And this time needs you to really test yourself, to really push yourself to be healthy. Whatever you can do to maintain your mental health, please do. People have different practices. Spirituality at this point is very important. There is very proven evidence between spirituality and health. It's been documented, it's evidence-based. As you know, that I don't do anything without evidence. I've studied at every level. I've just finished my master's. I've done everything, with evidence, and I am very, very, very logical. But I also know that logic alone won't get you everywhere you need to be. So spirituality is important, and however you practice your spirituality, please pursue that practice very strictly at this time. For some of us, it's prayer. For some of us, it's meditation. Whatever you do, put in a very strict regime to do that daily. There are various apps that are out there to help you. If you need help with meditation, with prayer, just do that. I felt like I needed to go on longer than usual this morning. I hope you've all enjoyed me talking at you. I hope it's not talking at you. I hope it's an interactive thing. I haven't really been looking at comments. Sorry. If there are any comments, I haven't seen them, but please put comments and share it. Now, tomorrow is Sunday. I'm considering not having this tomorrow to allow you all pursue your various spiritual practices. For those of you that are going to go online, you should all be going online for any spiritual practice. You shouldn't be going out of the house. Please do not go out of the house. If you know anybody going out of the house, tell them to sit down and not to do that, and report them here on Vine Health. So I'm thinking not to do this daily updates on Sundays because most people have their spiritual practices on Sunday. So if you agree, please just post that in the box. If you feel that you want an update tomorrow, also do that, and I'll go with the majority. Please send questions. It makes it interesting when we have questions as well. I've really enjoyed it this morning. Staying positive, keeping healthy. Share it, and I will see you either tomorrow or on Monday. Thank you so much, everybody, and bye-bye.